In this lesson, we're going to teach the foundational protocol. Over the years, we've found that this protocol, which includes all the lessons of this course, serves as a solid foundation for you in your progress over the upcoming months and years. If you currently have a therapist, please share this course with them. They can personalize it as needed to fit the treatment plan they've designed for you. Okay, to begin, let's start with a few terms we'll be referring to throughout this lesson. The first word is protocol. In this course, we define it as a set of guidelines used in developing a training plan. A rep is a full breath in and out. For example, if you inhale and exhale, that's 1 rep. A set is the number of reps done in a row. A session is the number of sets completed in each sitting. Okay, that's it for definitions. If I've lost you, wait. Remember, each lesson comes with downloadable materials, including the detailed clinical version of the patient protocol, your training checklist, and a daily journal. All of these materials and more are available next to this video on the right-hand side of the page. Okay, now it's time for the actual training portion of this lesson. Your training will be as follows. You'll train 6 days a week. You pick which 6. Next, each day, you'll have 2 sessions, 1 in the morning and 1 at night. Each session will consist of 2 sets and 10 reps per set. That equals 20 reps in the morning and 20 reps in the evening. So by the end of each day, you will have completed 40 total reps using the breather. If you don't have it out already, now is a good time to take out your breather so you can follow along with me during this lesson. As you learned in lesson 2, you should always start with your pre-session checklist. Time to get official. Let's start our first session. Okay, let's get started. First, sit up straight with your shoulders relaxed like this. Okay, next I'm going to ask you to do 10 breaths through your breather. Place your hand on your stomach to check for your diaphragmatic breathing and listen for the wind sound. Okay, I'll count your 10 reps. Now place the breather between your lips. All right, not your teeth. Let's begin. 1, 2, remember to keep your shoulders relaxed. 3, 4, don't tense up. 5, 6, 7, pace yourself, and pause slightly between inhale and exhale. 9, good job. And 10. Okay, good. How did that feel?
Good.
Did you get out of breath at all? Did you feel lightheaded?
No.
Okay, well, it's perfectly normal in the first weeks of training. Your body needs time to adjust to the increased exchange of oxygen and carbon dioxide, of course. And if you ever feel lightheaded, just pause for several minutes, breathing normally without the breather, and then continue. And if you feel you've rested enough, you can continue with your second set. The first week is a critical time as your body adjusts. Many people give up at this early stage and never reap the benefits. We know it's not easy right now, and you may want to quit as well. If you do, don't give up. Now that you've conquered the foundational protocol for your breather, let's start kicking it up a notch and increase the resistance levels of your breather. How did you feel about that set? Did it feel easy?
Yeah.
Okay, great. So now it may be time to increase your settings. Let's turn the inhale dial to 2 now and see how that feels during the next set. Did that feel okay?
Yeah.
Okay, good. So as you finish the 10 reps, this is the correct inhale setting for you now. If it starts to feel easy again, try to increase the setting again, maybe in a week's time. If you can do 8 or 10 reps at the new setting, you know it's the correct setting. So work up to 10 reps again. If you can't inhale vigorously within 2 to 3 seconds during each rep, or if you feel your stomach going inward while inhaling, your inhalation setting may be too high. Okay, so if you notice this, make sure to rest more between your sets and reps during this transition phase to higher resistance, or just simply go back to a lesser inhale setting for a few days and then try at a higher setting. Okay, now let's test your exhalation setting. That's good. Okay, I see that you're puffing your cheeks, so this setting is too high for you. Let's put it back one setting and try it again. That's better. Okay, that's your correct exhale setting now. So as for the inhale, try to increase the setting again next week. Finding the right setting is all about trial and error. About once a week, try out increased resistance. You may find you are ready to increase only the inhale setting or just the exhale setting at one time. Other times, you may be ready to increase both. While there will be times when you keep both inhale and exhale settings in the same position as the previous week. There may be times where you'll have a break from using your breather, such as during illness. When you are ready to resume training, you may find you need to decrease your resistance settings. Relax, this is normal. You will build your resistance and reps again, just as you did before. If you have to return to one on inhalation and one on exhalation, depending on your specific ailment, this too is okay. The important thing is to start your training again and get back to feeling your best. It's good to take note, for maximum benefits, it is often not necessary to train at the most difficult settings, even for an athlete. Some people never make it to the highest resistance settings on the dials. That's okay. If the highest setting you ever achieve is a 2, and you're making it to rep number 10 at 60 to 70% of your capacity while maintaining form, that's great. The most important thing is that respiratory muscle training becomes a part of your regular life. Try to build your sessions into your daily routine to maintain strong respiratory muscles for the rest of your life. Remember, whatever you do, don't stop training. You've trained too hard and come too far to stop, so keep it up. Like all exercise training programs, with RMT, you have to use it or you lose it. To keep up the training motivation, it's a good idea and very rewarding to keep track of your daily progress and record it in the downloadable training journal included in this course. Or you could go one step further and take part in research to help move the ball forward in respiratory healthcare worldwide by monitoring your progress in the Respiratory Training Target Database. If you're on our website, the link is on the right side of the page. If not, visit thebreather.com/join. There, you can evaluate the impact your respiratory muscle training has on your breathing, exercise capacity, speech and swallow function, your sleep, and your quality of life. For optimal benefits, start using the training database within the first week of using your breather, and then check in about once a month to record your progress. This concludes Lesson 3. Congratulations, you've completed the training course. We'd like to end by offering you access to additional bonus training videos and more helpful content. To get news about the latest research, to register your breather, to be the first to know about new treatment protocols, and to watch the shortcuts to respiratory hygiene and more bonus lessons, become a VIP member of the Breather Club for free. If you're watching this from our website, the link to join the Breather Club can be found to the right of this video. If not, visit thebreather.com/join. We hope you found this training course helpful. And if you have any feedback or have any questions, please feel free to reach out to us. You can email care@pnmedical.com or call 877-414-4449. We would love to hear your suggestions and provide you with more tools to help you on your voyage to improve your respiratory health.